Hello everyone! We are Group 4 of Caloocan TC and we are here once again to discuss with you a very interesting topic. And we can assure you that this will give you a great foundation and to help you become knowledgeable in caregiving. Okay, meet our team. Ma'am Rosalia Ramos, Ma'am Eileen Taganap, Ma'am Justine Torrio, Sir Odi Fortena, and yours truly, Emerald Santos. We will discuss briefly about the common medical terminologies for female and male reproductive system so that we will become familiarized about them and understand their importance to us. And also, we will tell you some about tips on how to properly care for this system. We will discuss briefly about the common medical terminologies for female and male reproductive system so that we will become familiarized about them and understand their importance, and also we will tell you about some tips on how to properly care for this system. So firstly, let's talk about female reproductive system. What is female reproductive system? The female reproductive system is one of the most vital parts of the human reproductive process, although a man is needed to reproduce. It is the woman who incubates the developing fetus and delivers the child into the world. Females are born with a large number of potential ova, or female sex cells, also called egg cells. However, it isn't until after the onset of puberty, typically around age 12, that these cells are mature enough to sustain life. The cells are ripened on a regular basis, but only one is released each month until a woman reaches menopause. Menopause commonly begins between ages of 45 and 55.
Hi, I am Rosalia and I will discuss about female reproductive system. First, I want to discuss about female breast. The breasts are medically known as the mammary glands. The areola is the circular dark color area of skin surrounding the nipple. Areolae have glands called Montgomery's glands that secrete a lubricating oil. The nipple is the center of the areola. Each nipple has about 9 milk ducts as well as nerves. Each breast has 15 to 20 sections called lobes. They are arranged like the petals of a daisy. Each lobe has many smaller structures called lobules. This ends in dozens of tiny bulbs that can produce milk. The lobes, lobules, and bulbs are linked by thin tubes called ducts. Each breast also contains blood vessels and vessels that carry lymph. The lymph vessels lead to small pin-shaped organs called lymph nodes. The sternum is a partially T-shaped vertical bone that forms the anterior portions of the chest wall centrally. Now, I will discuss about vagina. Vagina is a muscular canal approximately 10 cm long that is the entrance to the reproductive tract. It also serves as the exit from the uterus during menses and childbirth. The ovaries are the female gonads. There are two, one at each entrance to the fallopian tube. They are each about 2 to 3 cm in length. The fallopian tube, also known as uterine tube, are the conduit of the oocyte from the ovary to the uterus. Each of the two fallopian tubes is close to, but not directly connected to the ovary. The uterus is the muscular organ that nourishes and supports the growing embryo. It Its average size is approximately 5 cm wide and by 7 cm long, and it has 3 sections. The portion of the uterus superior to the opening of the uterine tube is called the fundus. The middle sections of the uterus is called the body of the uterus or corpus. The cervix is the narrow inferior portions of the uterus that project into the vagina. Fimbriae, finger-like projections of the distal uterine tube. Labia majora. The labia majora enclose and protect the other external reproductive organs. During puberty, hair growth occurs on the skin of the labia majora, which also contains sweat and oil-secreting glands. Labia minora can have a variety of sizes and shapes. They lie just inside the labia majora and surround the openings to the vagina, the canal that joins the lower part of the uterus to the outsides of the body. And urethra, the tube that carries urine from the bladder to the outside of the body. Bartholin's glands. These glands are located next to the vaginal opening on the each sides and produce a fluid mucus secretion. Next is clitoris. The two labia minora meets at the clitoris, a small sensitive protrusion that is comparable to the penis in males. The clitoris is covered by the fold of skin called the prepuce. And that's all my discussion. Thank you very much.
Thank you, Mom Rosalia. Okay, let's talk about male reproductive system. What is male reproductive system? The male reproductive system is a network of external and internal organs that function to produce, support, transport, and deliver viable sperm for reproduction. Prenatally, the male sex organs are formed under the influence of testosterone secreted from the fetal testes. By puberty, the secondary sex organs further develop and become functional. Sperm is produced in the testes and is transported through the epididymis and ductus deferens, ejaculatory duct, and finally urethra. Concomitantly, the seminal vesicles, prostate gland, and bulbourethral gland produce seminal fluid that accompany and nourish the sperm as it is emitted from the penis during the ejaculation and throughout the fertilization process.
Let's talk about it. Lateral view, the penis, is the male intromittent organ. It has a long shaft and an enlarged bulbous-shaped tip called the glans penis, which supports and is protected by the foreskin. The scrotum is a pouch-like structure that hangs behind the penis. It holds and protects the testicles. It also contains numerous nerves and blood vessels. Anterior view. The testes, singular or testis, are the male gonads, that is, the male reproductive organs. They produce both sperms and androgens, such as testosterone, and are active throughout the reproductive lifespan of the male. The epididymis, plural or epididymites, coiled tubular structure in which sperm start to mature and are stored until ejaculation. Lateral view, gonads, reproductive organs, or testes in men and ovaries in women, that produce gametes and reproductive hormones. Prepuce, also foreskin, flap of skin that forms a collar around and thus protects and lubricates the glans penis, also referred as the foreskin. The vas deferens is a firm tube or the size of a strand of spaghetti, that transports sperm from the epididymis. The urethra serves a dual function in males. This channel is the part of the urinary tract that transports urine from the bladder and the part of the reproductive system through which semen is ejaculated. The prostate lies just under the bladder and surrounds the urethra. Walnut-sized in young men, the prostate enlarges with age. The seminal vesicles, located above the prostate, join with the vas deferens to form the ejaculatory ducts which travel through the prostate. The prostate and the seminal vesicles produce fluid that nourishes the sperm.
Thank you, Mama Eileen. Okay, let's proceed to another topic on how to keep female reproductive system healthy. It's not easy being a woman. Women are still primary caregivers and nurturers in any family. Those who work outside have the additional challenge of juggling domestic responsibilities with professional aspirations. However, even as women effortlessly go about their varied roles, many end up neglecting their own health. The female reproductive system is susceptible to trauma, imbalances, and infections that may inhibit pregnancy, usher in infectious disease, or cause infertility. While there is no definite way to stop disease, there are precautions to take care or to keep your reproductive system healthy.
Tips to keep the female reproductive system healthy. First, maintain a healthy lifestyle, proper diet, healthy body weight, exercise, and sufficient sleep are habits that help your reproductive system. Being overweight or underweight may cause complications during pregnancy. Just as enduring constant stress may weaken your body's immune system and predispose you to infections, you should always remember that stress can alter your normal menstruation cycle and cause hormonal imbalances that may result in issues eventually. Second, quit smoking. A single stick of cigarette contains countless toxic compositions that lead to addiction, cancer, and coronary issues. Studies have shown that smoking can compromise the ovaries, the uterus, and other areas of the female reproductive system. Also, smoking during pregnancy can predispose your unborn child to congenital abnormalities. Third, go for regular screenings. With aging, getting a trusted gynecologist may be a great idea. It is advisable to go for routine screening, including pap smears and STD and infections tests. This will ensure early detection of any condition and ensure a better chance of survival. Fourth, practice safe sex. Safe sex is important for preventing diseases. Some STDs are incurable, including HIV, and this disease may alter your life permanently. Before engaging in sexual intercourse, you need to get your partner screened to be ensured that they are safe, or you can use condom to prevent the disease transmission. Fifth, have regular orgasm. Orgasm triggers the release of healthy hormones and prompt the contraction of the uterus, which can help ease and detoxify your body. The reproductive system will remain healthy and in good shape. Not to mention that it is an excellent stress reliever that can help you sleep better and ensure overall well-being. Fourth, make vaginal washing a part of your daily routine. Intimate care isn't something you should have to worry about. Only when you start experiencing discomfort. Regular care and preventive measures ensures you stay clean and healthy always. Care shouldn't be limited to washing only while bathing. Women should wash their intimate areas 2 to 3 times, especially during monsoon and menstrual cycles to keep infections at bay. Seventh, increased consumption of calcium and magnesium. Magnesium alleviates headaches, sugar cravings, dizziness, and low blood sugar linked with PMS. Calcium is effective for premenstrual fatigue, depression, and cravings. It is essential that these two vital minerals are combined because magnesium provides the mechanism that enables the control of modulation of calcium levels in the cells. The source of calcium and magnesium include seaweed, lentils, sesame seed, avocado nuts, bean, leafy green vegetables, and coconut. You can also get reasonable amounts of magnesium through your skin pores by using magnesium bath salt when you bath. 10 foods that will increase your fertility and libido in women. 1. Seaweed. Seaweed is packed with nutrients that help enrich the liver, kidneys, bladder, and adrenals, which are organs vital to fertility health. 2. Salmon. Salmon is full of omega-3 fatty acids which are proven to regulate blood flow to the reproductive organs. 3. Figs. Figs have been delivered to increase fertility since the time of ancient Greeks, and now we have scientific evidence. Figs contains a lot of iron, which is important for healthy eggs and ovulation. Next, oyster. Oyster have been known to increase libido, but oyster can also be a great source of fertility because they are packed with zinc, which increases the production of good quality eggs. Next is berries. Any kind of berries is good in protecting eggs from damage and aging because they are full of antioxidants. Strawberries have been linked to naturally increasing a woman's libido. Next is beans. Beans are a lean protein and are full of iron, which helps to increase fertility and libido. Low iron levels can result in anovulation, which is when having a ovulation does not produce a healthy egg. Next is leafy greens. Dark leafy greens such as spinach, romaine, arugula, and broccoli are high in folate, a B vitamin that has been shown to improve ovulation. Leafy greens also naturally increase in a woman's libido. Maca root. Maca root increases fertility in men and women by increasing energy, boosting the immune system, and providing vital minerals and nutrients. Maca root is packed with iron and iodine. Next is yams. Research shows yams have an ovulation-stimulating substance that can help boost fertility. Next is vegetables and fruits. Eating up to 3 servings a day of fresh fruits and vegetables is important for any diet, but especially important when trying to conceive. Foods to avoid. First, soy. Second is alcohol. Third is sugar. And fourth is saturated fats.
Thank you, Mom Justine. Now let's proceed to another topic, which is how to keep male reproductive system healthy. The male reproductive system is one of the most important parts of the body, and maintaining good reproductive health is essential to sexual development and procreation. However, many men often tend to overlook their reproductive health, and as a result, this can lead to numerous complications and diseases. Good reproductive health depends on diet, lifestyle, medical conditions, occupational exposures, and many other factors. The next slides will show you some easy and practical tips on how you can keep your most intimate partners healthy.
The next topic will be discussed by Sir Oliver.
Tips on how to keep the male reproductive system healthy. Number 1. Regularly screen for STDs. If you are currently sexually active and engaged in unprotected sex, it's important that you undergo a regular screening for HIV and other sexually transmitted diseases. Make sure that you use condoms when engaging in sexual activities to reduce your risk from contracting an STD. Number 2, practice good hygiene. This one is simple enough to follow. Wash your genitals regularly to prevent the accumulation of dirt and germs in your genitalia that can potentially cause infection. As an added tip, be sure to also wear clean underwear by changing them often. Number 3, maintain a healthy lifestyle. You may be surprised to know just how important a proper diet and exercise are towards maintaining proper reproductive health. Eating a nutritious diet, rich in nutrients, low in fats, and engaging in regular physical activity will help to ensure that your reproductive system is functioning at peak efficiency. Number 4, quit smoking. Past studies have shown that the majority of men who suffer from erectile dysfunction were found to have been smokers. Smoking clogs the small arteries that feed blood into the penis, making it difficult to attain an erection during sexual intercourse. Visit your doctors. If you want to maintain your overall and sexual health, you should make sure that you have a physical checkup at least once a year. Your doctor will be able to screen for any abnormalities or irregularities and take immediate steps to remedy the issue. You can also discuss with your doctor any concerns that you may have regarding your reproductive health. 6 food to boost prostate health. Number 1 is tomatoes. Some research suggests that a diet high in lycopene may help reduce the risk of developing prostate cancer. Number 2 is broccoli. Broccoli is a vegetable that contains many complex compounds that may help protect some people from cancer. Number 3 is green tea. Evidence suggests that special compounds in green tea may reduce the risk of prostate cancer by influencing tumor growth, cell death, and hormone signaling. Legumes and soybeans. Legumes are a food group that includes beans, peanuts, and lentils. Legumes contain biologically active plant compounds known as phytoestrogen. Isoflavones are one such phytoestrogen. One review found that people who ate the most phytoestrogens had a 20% reduced risk of prostate cancer than the group with lowest intake. Pomegranate juice. The NCI or the National Cancer Institute says that pomegranate juice and some of its bioactive components may help inhibit the proliferation of prostate cancer cells. Fish. Polyunsaturated fats including omega-3s and omega-6 are essential fatty acids found exclusively in the diet. They are not synthesized by the body. Several reviews have reported that while there may be a link between higher omega-3 fat consumption and a lower risk of high-grade prostate cancer and prostate cancer mortality, more research is needed, especially in human studies.
Thanks everyone for watching, and I do hope you have learned a lot of things from us. Have a great day!